Have you ever run your fingernail along the surface of your tooth, right down near the gum line, and felt a catch? Maybe it felt like a small ledge, a little ditch, or a sharp notch carved right into the enamel. For many, finding this little groove comes with a sudden, sharp zap of sensitivity to cold water or even just the air. It is one of the most common complaints in dental offices around the world. Naturally, when people see that part of their tooth missing or worn away, they immediately start blaming themselves. You look at that notch and think, I must be brushing too hard. I've scrubbed my gums away. You might even switch to a super soft toothbrush or stop brushing that area entirely out of fear, yet the notch keeps getting deeper. But here is the truth that might surprise you. There is a very high probability that your toothbrush has absolutely nothing to do with it. You aren't scrubbing your teeth away, you are crushing them. We are looking at a battle between your stress levels and the structural integrity of your teeth. The damage you are seeing at the gum line isn't about hygiene, it is about physics. It is a condition called abfraction, and it is the direct result of the immense forces we place on our teeth when we are stressed, anxious, or purely overwhelmed. Today, we are going to dive deep into why your body is destroying your enamel, the science behind how it happens, and most importantly, how to stop the destruction before you lose the tooth entirely. To understand why this happens, we first have to look at the silent epidemic driving it. We live in a high-pressure environment. Whether it is the stress of a commute, the pressure of a deadline, financial worries, or just the fast pace of modern life, our bodies are constantly reacting to tension. And for a vast number of people, that tension finds its release in the jaw. The muscles that control your jaw, specifically the masseter muscles, are the strongest muscles in the human body pound for pound. When you are eating, you only use a fraction of their power. But when you are stressed, or when you are sleeping, the central nervous system can engage these muscles to clamp down with incredible force. We are talking about hundreds of pounds of pressure per square inch. This is what we call Bruxism, or clenching. It is important to make a distinction here. Many people think, I don't grind my teeth, I don't hear any noise, but grinding and clenching are different beasts. Grinding involves movement, sliding the teeth back and forth, which wears down the top biting surfaces. Clenching is different. Clenching is silent, it is static, it is a vice grip. You might be doing it right now while listening to this, and you wouldn't even realize it until you consciously drop your shoulders and unclench your jaw. This static pressure is where the mystery of those notches at the gum line begins. For decades, the prevailing wisdom was almost entirely focused on toothbrush abrasion. The logic seemed sound at the time. If you take a stiff brush and an abrasive paste and scrub a surface long enough, eventually you will wear a groove into it. And that does happen. It is a real thing. But abrasion looks very different from what we are discussing today. Abrasion usually results in a wide, scooped-out shape. Imagine taking a spoon and scooping out a bit of ice cream. It's smooth, it's rounded, and it's usually shiny. However, look closely at your own teeth or the images you might see of this condition. If the notch at the gum line is sharp, if it is shaped like a V or a wedge, that is not from a toothbrush. You cannot easily brush a sharp V shape into a rock-hard object. That sharp angle tells a much more violent story. That is the hallmark of structural failure. That is abfraction. So, how does stress and clenching cause a tooth to break at the gum line? Why doesn't the top of the tooth break instead? To understand this, we have to look at the biomechanics of a tooth. Think of a wire coat hanger. We have all done this experiment. If you take a wire coat hanger and you want to break it, but you don't have a pair of wire cutters, what do? You grab it with two hands and you bend it back and forth. You flex it. At first, nothing happens. But as you keep bending it, the metal gets hot at the bending point. It fatigues, and eventually, snap, it breaks cleanly right at the point of greatest flex. Your tooth acts very much like that coat hanger. A tooth is not just a lifeless rock. It is a complex structure rooted in bone. When you bite down normally, the forces go straight down the long axis of the tooth, which is exactly how nature designed them to work. They are incredibly strong under compression. But when you clench from stress, or if your bite is slightly off, the forces aren't just vertical. They become lateral. you are pushing the tooth sideways. Because the tooth is held firmly in the bone, the top part of the tooth flexes slightly. It is microscopic, and you can't see it with the naked eye, but the tooth is actually bending. Now consider the material of the tooth. The outer layer is enamel. Enamel is the hardest substance in the human body. It is crystalline, almost like glass. It is fantastic at crushing food, but it has zero ability to stretch or bend. It is brittle, so you have this massive force bending the tooth. The point of the tooth that experiences the most stress, the fulcrum, is right at the gum line, where the hard enamel meets the softer root surface. As the tooth flexes back and forth, night after night, clench after clench, the chemical bonds of the enamel crystals at that stress point basically explode. The enamel rods fracture and pop off. This leaves behind that sharp, wedge-shaped notch. It's literally the tooth shattering in slow motion at its weakest point. This is why you can have perfect oral hygiene, use the softest brush on the market, and still see these grooves getting deeper and deeper. You aren't brushing the tooth away. You are stress fracturing it from the inside out. The implications of this are significant because it changes how we have to treat it. If you treat abfraction like a hygiene problem, you will never fix it. You have to treat the force. How do you identify if this is happening to you? Aside from the shape of the notch, there are other signs to look for. Sensitivity is a big one. When those enamel rods pop off, they expose the dentin underneath. Dentin is porous. It has little tubes that lead directly to the nerve of the tooth. That's why cold water feels like an electric shock. You should also look at the symmetry. Toothbrush abrasion usually happens in a line across multiple teeth because you brush them all at once. Abfraction, however, is often isolated. You might have one tooth that has a terrible notch, while the neighbors look fine. That is a major clue. It means that specific tooth is taking more of a beating than the others. It's hitting the opposing tooth too hard or at the wrong angle, taking the brunt of that 200 pounds of pressure. Another sign is recession that doesn't seem to be caused by gum disease. Sometimes the constant flexing of the tooth also irritates the gum tissue attachment, causing the gums to pull away. If your gums are receding but they aren't red or inflamed, look for the notch. It's likely a bite issue. And of course, look for the evidence of the cause, stress. Do you wake up with a stiff neck? Do you get tension headaches, particularly in the temples? Do you find yourself pressing your tongue against the roof of your mouth or catching yourself clenching while driving or concentrating? These are the behavioral smoking guns that link the stress to the dental damage. So, we have established that stress leads to clenching, clenching leads to flexing, and flexing leads to abfraction. What can be done about it? The first instinct is often to just fill the hole. It makes sense visually. You see a notch, you want to patch it with a white filling. And while this can help with sensitivity and aesthetics, it is often a frustrating process for both the patient and the dentist if the underlying cause isn't addressed. Here is a common scenario. A patient gets a filling in one of these notches. A few months later, they come back, and the filling has popped out. The dentist puts it back in. 6 months later, it pops out again. Why? Go back to the coat hanger analogy. If you put a piece of tape over the spot where the wire is bending, and then you continue to bend the wire, the tape is going to peel off. The tooth is still flexing. A dental filling is rigid. It cannot flex with the tooth. So, as you continue to clench, the tooth bends, the bond breaks, and the filling fails. This is why, before we even talk about mechanical protection, we have to talk about biological reinforcement. You need to make sure your mouth's natural defenses are actually strong enough to hold on to those repairs. There is a fascinating new approach, a strange red dental foam ritual that takes just 10 seconds a day. It targets the hidden bacterial biofilm that weakens your gums and enamel, helping to remineralize your teeth while you sleep. I want you to take your phone out and scan the QR code on the screen right now to watch a short presentation on how this red foam works. I have also pinned the link to the top of the comments section below. It is a crucial step for fortifying your teeth against this kind of structural damage. Now, alongside that biological support, to truly fix abfraction, we also have to stop the flex physically. We have to manage the forces. To truly fix abfraction, we have to stop the flex. We have to manage the forces. The gold standard for this is usually a bite guard or an occlusal splint. This is a hard acrylic device, worn usually at night. It does two things. First, it separates the teeth so you can't lock them together. Second, and most importantly, it distributes the force. Instead of one single tooth taking a massive hit and flexing, the guard spreads that pressure across the entire arch. It absorbs the energy so your enamel doesn't have to. Another crucial step is what we call occlusal adjustment or equilibration. Sometimes the problem is just one high spot on a tooth that is interfering with your bite. By microscopically reshaping that tiny interference, we can redirect the forces so they go vertically down the tooth, rather than pushing it sideways. Once the bite is balanced and the lateral forces are removed, the tooth stops flexing. Only then, once the bite is stable and the clenching is managed, does it make sense to restore the notch with a filling. In fact, modern dental materials are getting better at this. We now have slightly more flexible, flowable composites that can bend a little bit with the tooth, which helps retention, but nothing replaces the need to fix the bite first. This brings us back to the root cause: stress. As dental professionals, we can fix the tooth, we can give you a night guard to protect the system, but we cannot remove the stress from your life. That is the variable only you can control. Understanding the link between your mental state and your physical health is empowering. When you see that notch in your tooth, view it as a warning light on your car's dashboard. It is your body telling you that the system is overloaded. It is physical evidence that you are carrying too much tension. If you are noticing these signs, the V-shaped notches, the sensitivity, the receding gums on a single tooth, don't ignore them. Don't just buy sensitive toothpaste and hope it goes away. That notch is a structural crack in the foundation of your smile. Consult with a professional who understands occlusion and the biomechanics of the bite. Ask them to check your bite balance. Ask about a night guard. It is a small investment to protect against catastrophic failure later on.